Okay, life as a midwife for me is great. You know, it's rewarding. You're helping lots of families and seeing lots of babies and taking care of women in their most vulnerable times of their lives, right? So as a midwife, you're full of all of that, but you're also experiencing a lot of fatigue in there. That's a big part of the job because you are, especially if you work as it really doesn't matter if you're an independent midwife or a midwife that is working at a practice, at a hospital, wherever. It's a very demanding job, and it's a job that takes a lot of you. You know, it's more than just technical work. It's a lot of emotional, a lot of mental attention that is put into the job of being midwife, right? So I have this picture up here because me sleeping in the tub there is a real thing. I was at a birth one night and we were done. She was bonding and all that good stuff, and I was tired. So I needed to go take a nap before I drove home 30 to 45 minutes away, right? So that's a real reality.
I think I didn't realize, I've been practicing for 3 years, the emotional investment that you put into it, because I'm seeing my moms 12 to 14 times prenatally. So they're seeing you consistently and you become emotionally very invested in it. And so, I mean, that's good in a lot of ways because you know the family really well. But in the other way, it can be really draining because you're very invested and you know the family situation, you want to make a good decision for them, and sometimes you're walking with women, sometimes they're going through really hard things, and you're walking through those really hard things with them. So it can be really, really draining and hard as a midwife because you want to fix things, but you can't. You're there to just support them and give them the best health care that you can. I think one of the other challenges is being out of hospital is you don't have a button you can push. You don't have people who can come and resuscitate the baby. So there's a certain amount of stress that you carry. I try to explain to student midwives, there's a certain amount of stress that you carry at every birth that you go to because you know things can change quickly and you have to be ready to respond. And so even if it's a 2-hour birth, we still come away feeling exhausted. And it's the emotional stress of like being prepared for whatever might happen at that birth, because you know, like, while this woman is still low risk, you're watching for signs of anything, and it may change quickly, and you may have to think and respond quickly. So, I mean, I think that it's.
And then as a hospital midwife, when we switch settings, you know, it's still. Yeah, you're hitting that. Go ahead.
Yeah, because I had the post-traumatic.
Okay.
So I left the hospital because I had post-traumatic stress disorder. That's really why I left. So when you're a hospital midwife, if you are a conformer, and this is personal to everybody, how well do you conform to a bureaucratic system? So if you go to a really good midwifery program, because there are some that are medically dynamic, and so I would just say if you're at a place where they really put medicine at the forefront, then they may not be the most fantastic natural place to be. We'll put it that way. There may be people there who are doing that, but that may not be their strongest suit. So if you're in a program that is very midwifery directed, and they are reprogramming you from your nursing mind into a midwifery model of care, and you embrace that, it will be very difficult to practice in a hospital. But we do need people to practice in a hospital, because at the end of the day, every mama can't afford a home birth. At the end of the day, every mother is not an appropriate candidate for home birth. Every mother is not an appropriate candidate for the birth center. So they may have to go to the hospital. They may not have the money to put themselves in a different arena to have a birth. So we need really natural practitioners across the board. But I could see where if you're really a natural practitioner, after some time you're going to get burnt out in that environment. You're going to need to rotate out. So it's nice if other people tag in to hit the most stressful environment that you possibly can, because it really is stressful to go to work every day and fight for the research that you learned in school, and to fight for what you know is correct. No, she doesn't need Pitocin. She's moving, and it's okay that she's moving a little slower because she's a first-time mom and she's allowed to move a little slower. Don't follow me around the unit with a chart asking me to write an order for Pitocin. Don't bring me my chart because the mother doesn't have a soft cervix, and we need to start with Cervidil. Telling me Cervidil costs $1,000. Can you write an order for Cytotec, which has a black box warning on it? And so I can't defend that in court if I go to court. That I gave a pregnant woman a drug that has a black box warning on it not to give to a pregnant woman because it costs you $1. So there's a lot of bureaucracy in the hospital, and if it's not your personality, you'll quickly become tired of that. But now the benefit of it is, if you are not doing well in home birth, if your area is flooded, if you can't get a lot of patients, you can go to the hospital and work. If you want somebody to pay for your continuing education and you want a call schedule that's set and you don't want to be on call all the time, you can be in a practice. So there is a lot of versatility in being a nurse midwife, but all areas, regardless of which way you go, we're from different ways. They do all have a drawback, and so you'll really need to think about which drawback you can tolerate and which one you can't. And we have a question over here.
Yes. I didn't know that women were giving birth at home in the state of Georgia. Because I know it's not regulated.
Yeah, they can. They absolutely can. We have no laws against where you birth at in the state of Georgia. There are no laws on that at all. You can birth wherever you like, and the state gives us a password to put our birth certificates in. We enter them ourselves just like the hospital does, so there's no law against where a woman births at in Georgia.
Certified professional midwives are not licensed in this state. They're licensed in 31 states. We're working on legislation right now to try and get the licensure. We have 38 CPMs in the state of Georgia. So we're working on licensure for it, but we are able to file birth certificates electronically. We're not recognized, but we are recognized. It's
it's a weird place.
Limbo place. And so there's some hostility that you have to kind of deal with that with transfers because, some doctors recognize it and recognize the work that we're doing, and even nurses, especially ones that have worked in other states where they are licensed. But there's also this sense that, well, you're illegal. You're not licensed. You're not a licensed healthcare provider. We're working really hard to change that. It needs to change. All the states around us have licensure for CPMs, and the whole country is moving towards that. Georgia is just taking a lot of time to get there. But nurse midwives have licensure and are recognized to be. Often when I talk with legislators, they say, well, why don't you just become a nurse midwife?
We'll talk about all of that.
Because it's crazy. Honestly, what I would want to say is, I worked as a doula. I attended about 150 births in the hospital as a doula before I went to midwifery school. And the nurse midwives that I really loved were really frustrated in the hospital. They said, I can't practice midwifery the way that I was trained. I can't do what I know is right because I'm tied to the doctor who pays my check. And I have to do. So they felt a lot of frustration. After attending so many births and seeing that frustration, I thought, I will bite my tongue off. I'll go crazy if I'm in this environment in the hospital. We need the hospital. We absolutely need it. And we need midwives there because there are certain, there are people who their blood pressure gets real high or their baby starts having issues. We need to be at the hospital. And I want a nurse midwife there that I can transfer to and talk to and understands how I'm practicing.
And what will make a good midwife is really being experienced in multiple settings. Okay, because you're able to have perspective. That you're able to compare and contrast and decide what it is you really want to do in the long run. Delandra, you had something to say.
I wondered, when I considered if I wanted to pursue CPM versus CNM, one of the things I wondered about was just kind of that relationship that you can have with the mothers when you are working with them one-to-one, like in a home birth environment, versus it seems like nurse midwives that are working in a hospital setting, you just don't get to build that relationship with those moms. So maybe there is someone that
It's true.
It's
more difficult. It can be done, but it's definitely more difficult, and it's shunned. So you can be in an office with several midwives, and the clients are requesting specific midwives,
Mhm.
and they're being discouraged
Right.
to build the bond.
Mhm.
They're being told, oh, you need to rotate through everybody
Because
here
you
because you don't know who will be at the birth.
Mhm.
And I tell people all the time when I was in that environment, if you come in here in labor, you're not really concerned that I'm not here. It would be great, but that's not gonna make you or break you. What you do need is a continuity of care. And some